testes in the scrotum, hanging in between the legs, that every man should have. So they are connected, leads into the male external organ responsible for the act, for copulation. Now, at any point in time between this long passage, the testes, the seminiferous tubules, the vasa differentia, the prostate, the male organ, any infection, any blockade, any obstruction can lead to infertility. Infection are normally acquired causes, so we won't discuss that for now. But since we are talking about the congenital causes, that means he was born with them. Those things are basically what we see there are blockades or poor formation. They were poorly formed at birth. So the man came out with some men have one testis poorly formed as against the other. Some men have a few men we've read from literature, and I'm sure my some of my colleagues, trauma because of accidents, because of infections. The doctor may have to take out one at one point in time. Now that's leaving the congenital and going to the acquired. But basically speaking, in the congenital causes, we see poor formation, malformation, or a blockade or an obstruction that the man, the child, the boy was born, the male child, now a man was born with. Now let's leave the congenital and come to the acquired. A number of things can also be found here, from trauma, from infections, to lifestyle, to health conditions. So someone has an infection that affects the testis, and he or she doesn't get he doesn't get medical attention. It can affect the testis and put it to its function is finished. Something called orchitis, epididymo-orchitis. There are two components of them, doctors and long words. So that's one. Infections of the vasa differentia of the seminiferous tubules can also cause infertility if not treated. The commonest cause that we see is what we call varicocele. Engorgement, enlargement of the veins of the varicocele. They end up, once this happens, it makes the testis heat up, and then by divine process, the testes were made outside, inside the scrotum, because they are, if they heat up more than the temperature that God had designed them to be, they lose function. So the temperature in the testis is slightly lower than the temperature found inside the body. God had made it that way so that it's in its own environment where it can cool off once the temperature in the body is higher than it wants it to be. So in varicocele, the temperature in the varicoceles become higher than normal, and then they kill the sperm cells. So those are infections. Trauma. You are playing ball, or you are at a sport. Let's not limit it to football. Doing a sport. It may be normal sport and extreme sports. Accidents. You have a trauma that hits the groin, affects the scrotum. It hits the injury, causes the impact causes injury that affects it. It's swollen or it's burst. It has to be taken out. Can cause infertility. Other things like lifestyle. People men that are what we call obese, big, physically speaking. A man is big. What scientifically speaking, what we calculate, we talk obesity as weight over the height squared. The weight of the individual in kilograms divided by the height, the square of the height in meters. Once you calculate it and it's more than a certain, there are figures that we use, mild, moderate, severe obesity, it can affect, it can cause infertility, because testosterone production that is responsible for making the man be a man, for making a male be a man, is affected. And testosterone is the single most important male hormone that's responsible for the other hormones, but it's the main hormone, the culprit, not the culprit, the hormone that's responsible for making a man, for making a male be a man in that sense. Then the other thing that can also cause infertility is hypertension. Blood pressure is high. The blood flows through the veins all over through the blood vessels all over the body, especially the arteries at a high rate. It can cause infertility. Other things that can also acquired causes of infertility are diabetes. These are health conditions. And then we see drugs too. Drugs. There are medications that men take for one reason or the other that can also have that side effect. Then things like radiation for one health challenge or the other, radiotherapy now, or men that work exposed to radiation because of the nature of their jobs, that also causes infertility. Then long distance truck drivers, because
you
of
sit for hours.
Yes, so you sit for hours, and the heat generating component of the machine is just directly under where the seats are. So you drive from Sokoto to Calabar, from Maiduguri to Lagos, today, tomorrow, next month, next year, 10 years, 20 years. So this heat is gradually cooking the testis, exposing it to heat that would kill off the sperm cells. I think I should stop here. There are some other things, but let's not go into a lecture.
Smoking, as
exactly,
part of the lifestyle.
exactly.
Yeah.
So smoking is an acquired cause of infertility, and it's simple. You smoke. The last time I was here, we talked about smoking. So it causes a wide number of a large number of health challenges. Caused the infertility. Then again, the infertile man, if he accesses treatment, can become fertile. And it does not mean that the boy child that would come out from that union must be infertile. No. So if the genetic component is there, yes. If the non-genetic component is there, if the genetic component is there, yes, the child may become infertile. If the non-genetic component is what you are dealing with, the child may not become infertile. He would grow up and become a normal man, have children, and then live a normal life. The third question you asked was
the issue of the treatment.
Yes.
Is there treatment for that?
Yes. We are glad to see there are treatments. There are treatments available. It used to be a Lagos thing or an outside the shores of Nigeria thing, a Lagos thing or Abuja. But we are glad to announce that treatment is available, even in Jos, on the Jos Plateau. The Apex Medical Facility Institution on the Plateau, the Jos University Hospital. Now, infertility is within the purview of the urologists. It's a subspecialty of surgery as a discipline, as a medical discipline, as a medical specialty. Now, there are times when it is a multidisciplinary approach. Sometimes it's straightforward. A urology specialist would handle it. Urologist would handle it. Sometimes there is need for the urologist as a doctor to put heads together with other doctors, like endocrinologists, if the patient is a diabetic, like cardiologist, if the patient is a hypertensive. But in between all of this, myself and my colleagues, our subspecialty, our specialty, family physicians or general physicians, are always the first point of interaction with these patients. Most times the patients present to us first. We see them. We make part of the diagnosis. If we can treat, we treat. If it's becoming more detailed, more time, what we call chronic, it's going to take a long time, we send the patients over to the urologist to take over the treatment and continue to manage. Also, if it's going to involve surgery, the urologist, we send those patients to the urologist to take over and continue to manage. Then there are instances where it's not surgical. It's basically hormonal challenge. The testosterone that is responsible for making a male a man actually comes from the brain. The factor, the chemical responsible for secreting testosterone comes from the pituitary gland, and the pituitary gland is in the brain. So it sends signals, chemical signals, down to the testes that releases testosterone to do the work it's supposed to do. So you may have to work with the chemical pathologist. You may have to work at some point in time if the challenge is hormonal. So there are treatments available in Jos, and there have been instances we've treated people and they've been from infertile to fertile. I also am aware that a number of private medical facilities in Jos are offering treatments for infertility, not just for the male, but also for the female. But I'm not permitted to mention names here.
Yes,
I
you've mentioned youth.
I will limit myself to Youth and Plateau Specialist Hospital.
Yeah, so I know there are lots of stigma attached to it. That's why, male infertility is, we're silent about that.
You're right. There's a stigma attached to it.
So what are those myths associated with male infertility? Are there myths or stigma?
Yes, there are myths. No, I would prefer to use the word stigma.
Okay.
And I would prefer to use the word stigma. Basically, you and I know that a couple gets married. There's no child after a year, after 2, after 3. Accusations normally start on the female partner, on the female gender, the wife now. But like we said earlier in the course of this discussion, males can also be responsible for infertility. So the wife may be the fertile one, the male may be the one with the challenge. Now, having established that, the the male can, once treatments have been initiated, and okay, let me leave that and answer your question directly, so that I'm sure our listeners are listening. The stigma associated normally because once it has been established that the man is responsible, society sees that individual as less a man. Yeah. Your ability, or the society views your ability, views you as a man in the real sense. If you are able to procreate, you're able to put a seed into a woman, and after 9 months we see tangible results. You can see, you can hold, you can feel. This is the result of something that happened 9 months ago, the baby in this instance. Now, so without that, the society views that individual, that man, as less of a man. So there is some secrecy. There's the whole thing is shrouded in secrecy. I don't want people to know I have this challenge. I don't want people to see me like less of a man. I don't want people to know I cannot make my wife pregnant. We see that a lot. We see that frequently. And you won't blame the man for feeling that way. Society has caused so. Then the other thing that we've also seen in the course of interacting with these patients is inheritance issues. We are Africans, and most African societies are patrilineal as against matrilineal. What that means is that the male is the head of the home. The children that will come from that union would bear his name. They would take after him in life, in work, in everything. So I don't have children who would take after me, who would carry my name, who would succeed me. I have one plot of land in my hometown. I have a plot of land here. I have some savings in the bank. Who will take after me? Probably my wife and myself and my wife are of the same age, or the age difference is not much. We would live by nature. We would live after a while. Who would carry on my name? Who would take care of me when I'm old? Now, for us doctors, all of these things matter. Once it matters to the patient, it matters to us as doctors, because our goal in doing our jobs is to meet patient satisfaction. So those are some of the secrets or myths, to use your own word now, associated with infertility. And when the patients come, we try to listen to them and then address these things. Once the couple become fertile and a pregnancy ensues, most of those things go away. They fizzle out. Yes. We've seen quite a number of that. So that is it.
Okay. We would take a break.
Okay.
When we come back, we'll continue the conversation with our listener now, calling in to also ask questions and also make their contributions on the program. If you're just joining in, you're listening to Good Morning Plateau on Peace FM 90.5. We've been looking at male infertility, and with a specialist in the house, Dr. Basile Ginsel. He is a senior registrar with the Department of Family Medicine, Jos University Teaching Hospital. This conversation continues after this break. Stay with us.
Wake up to the rhythm of the confluence. This is Good Morning Plateau on PRTV Radio, 9 to 10 a.m. daily.
Welcome back to Good Morning Plateau on Peace FM 90.5. Thank you for staying tuned. It's time for the listener to also be part of this conversation on 0812-588-6048. Just to repeat what our doctor has said throughout this conversation, infertility is a medical condition, not a cause, and treatment is possible. And men should also go get tested. Yes, it's a two-way thing. If you want to have babies, it takes two to make a baby. And for proper diagnosis, you can visit the hospital. There are specialists there waiting for you. Most importantly, avoid quacks. I know when things like this happen, because of the privacy, we tend to go for herbal medicines, herbal treatment and stuff like that. So this morning, we're saying no to that. Go to the professionals who are ready to help out. So you can join us on 0812-588-6048. Dr. Basil Ginsel is here. He is a senior registrar with the Department of Family Medicine. He's here to give us answers to our questions. Hello, good morning.
Good morning.
Thank you for joining us.
How are you doing?
I'm good.
Krankes Kadung, calling you from Pushit.
Krankes, you're very intentional this morning. You're very intentional. Okay, Krankes, go ahead.
You see, as a majority leader, I will not rush what I want to say.
Okay, you're speaking like a big man then. All right, let's hear you, Krankes.
Yes, I want to appreciate the effort of our guests this morning for this very great enlightenment.
Thank you.
And you see, I have a case that a couple married. For a quite long time, they didn't get an issue. But he divorced her and married another woman. They have baby. So also that woman go and marry somebody, they have baby. What caused that? And they are the farmers, they are living in rural areas. They are sleeping together with his wife. Are you getting my point?
Yeah.
Yes.
Yes, I heard you. Our guest says that if you marry and you are far with your woman, you cannot carry. She cannot be able to give birth to maybe a baby or a boy. But those people are living together 4 and 6, and there is no issue. We have so many problems in this case. So many people have this problem. So we need more awareness of people in rural areas.
Okay.
So that they should go for check-up and then so on and so forth. So I love this show. Keep what they're doing up.
Thank you so much,
we need
Krankes.
more awareness about this.
Thank you. More awareness.
Thanks, Amelia.
Yes, thank you. Especially for people in the rural areas. They want to know. I think his question is, this time around, is not distance. They're together.
Yes.
But the couple are not procreating. All right. Let's get this other caller. Hello. Good morning.
Good morning, ma.
Good morning.
Yes, my name is Tanay Ado calling from Sabombar Kijindri.
You're who?
Tanay Ado from Sabombar Kijindri.
Okay, let me use the Ado. Can you just step away from your radio set? I can hear myself.
Okay.
Yeah.
Yes, I want to give kudos to our guests in the studio.
Just switch off the phone. I beg your pardon, the radio.
Okay. I should lower the... Yes, are you hearing me now?
I can hear you, but I can also hear myself.
Okay.
Okay.
Are you hearing me now?
Yeah, you're good now. Go ahead.
Yes. I said my name is Ado calling from Sabombar Kijindri.
Okay, Ado, go ahead.
Yes. I want to give kudos to our guests in the studio for this great awareness on this infertility. This is becoming a serious issue in our various families' affairs in terms of marital issues. So I so much love the way he handled these issues on the media, but I want to advise for the medical practitioners to also step down to our various villages, because most cases do happen in our villages. So if it is going to be possible, let them step it down to our primary health cares in our villages so that this particular awareness can go around and people will be enlightened on this particular issue. Thank you so much, ma'am.
All right, Ado, we appreciate that. He's calling for the desensitization to be carried down to villages. We appreciate that. And I think you can also be an ambassador as well. Thank you, Ado. 0812-588-6048 is the number to join this conversation. Hello, good morning.
Hello, good morning.
Good morning.
Thank you. This is Monday Kesko from Panyam.
Okay, Monday, go ahead.
Thank you. Thank you, Mr. Doctor, for this education.
Thank you for
could you
your
be
kind words.
more elaborate on for a male being with a low sperm count, and I don't know if it could be genetic and curable. Thank you very much.
Thank you. He's trying to ask a person with low sperm count, is it genetic, and then is it treatable? All right. Thank you, Monday, for that question. You'll get an answer from the doctor in the house. 0812-588-6048. Hello.
Hello.
Hello, good morning.
Good morning, how are you?
I'm fine. Hello.
You are speaking with Bashir Usman, calling you from Yalwan Tower.
Okay, Bashir.
Yes.
All right, go ahead, Bashir.
Okay, I just called to greet you for a wonderful job you are doing this morning. May God bless you abundantly.
Amen. We appreciate your call. Thank you.
Yes.
All right. Thank you so much for your call this morning, Bashir. 0812-588-6048 is the number. Hello. Hello. Good. So when you're calling, remember to turn off your radio set or keep it low so that we can have a meaningful conversation. Hello, good morning.
Good morning, ma.
Thank you for joining us.
Thank you. This is Johanna from School for the Blind Children.
Okay, Johanna.
Yes, I want to appreciate the doctor. He has spoken very well, but some of the terminology is really difficult to understand. But the question I want to ask is, sometimes some of the women don't know their ovulation period. So I want the doctor to explain how they will understand their own ovulation.
Okay, Johanna. Thank you.
Yes.
Any other question? Okay, he's gone. All right, 0812-588-6048. This might be the last call. We'll pick. Hello. Okay, when you're calling, ensure that your radio is off or you stay far away from it so that we would not have a fallback. 0812-588-6048. Hello, good morning.
Good morning.
Thank you for joining us.
Start calling from Panshin.
All right, Chris, go ahead.
Thank you so much. I think it's a good one today. Infertility is a thing of concern in our family, even the society as a whole. And I think the guest has actually done justice to the topic. Well done, sir.
Thank you.
I want to put it across that we have had people going to herbalists in respect to the issue of trying to get fertility fixed. What is your take on that? Then secondly, the issue of IVR. Some people they want to get it through IVR, or do they call
IVF.
it
IVF.
sorry.
Yeah.
Some people have debunked that
going for this IVF is not the best, because sometimes from the biblical point of view, they will say that it is sin. What is your take on that for those that have tried all other means of getting it correct fix and couldn't get it, so the option is for them to go for IVF? What will be your take on that? Then last but not the least is the fact that the issue of infertility, some people have attributed it to the fact that some people can take advantage of you to actually acquire wealth. I've had that on so many occasions, that some people can decide to give themselves to remain infertile because they want to get wealth. I don't know to what extent we can justify that. I think that is what I have done. We need to actually go for checkup, and that is very, very critical, very, very important. And with what is happening in the society today, sometimes if you don't have it, this issue of stigmatization is on an increase. And you have actually, what is the option? What is the hope of somebody that is under stigmatization? Thank you so much. Have a good day.
All right. Thank you. Thank you, Chris. We'll go back to our doctor in the house who would address the issues raised so far.
So thank you once again. It was going to be an interesting conversation, judging by the number of callers that have called in. So I want to start by saying thank you for the kind words the callers give us, you and I, this morning. It's complimenting. So the first question that was asked was a couple living together but have not been able to get pregnant. Yes, couples must not necessarily be living apart or together before they can be termed infertile. So they may actually be living together, but they are infertile. They may be living apart, but still be infertile. It's a whole mixture of it's a potpourri of events. Quite a number of things are involved. The problem may simply be a blockade. For example, like we said, one of the tubes is blocked. So we've seen instances of couples that live far apart, live and work far apart from each other, but pregnancy happens. So they're living together must not necessarily translate to a pregnancy. I'm sure there are causes, if they are able to visit the hospital, we're able to establish that the fact that they've lived long together, there's a problem that had not been addressed that is making them infertile. The second question that was asked, or comment or request, can we do this good thing we are doing? Can we come to the rural setup and do same? Yes, at our level, we are doing so. I'm aware that because I work in youth, the Jos University Children's Hospital have a comprehensive health center in Genderi, Mangu local government, and in Zamko, Langtang North local government areas of Plateau State. And doctors of different specialties are taken from youth in Lamingo, Jos, to rotate to work in these comprehensive health centers. And that is specialist enough. These are specialists that are sent to go and work in the rural areas. For those that are, because of time constraints, because of financial constraints, are not able to come to Jos, Genderi is in the central senatorial zone of Plateau State. Zamko is in the southern senatorial zone of Plateau State. I would advise they go to any of these, depending on how close your location is, depending on your locality, and then access any of the specialists there. If there are things, if the challenge are things that can be done there, fine. If not, it's an easier route of referral from any of these comprehensive health centers to the main complex here in Jutin Lamingo. So apart from that, in the general hospitals too, this falls within the purview of the Plateau State Hospitals Management Board. There are general hospitals, and a number of them have specialists, people that have done, doctors like myself that have done postgraduate medical training and are competent to handle it. But if it require some technique, some equipment, some finesse that they cannot provide at these general hospitals, they could come to Plateau State Specialist Hospital or Jos University Teaching Hospital. Again, because we are interested in healthcare and expanding the scope of services that the populace should get, the what was called Jankwanu, it is still called Jankwanu, has become a teaching hospital. So there are more specialists there than it was before, than they had before, that can also do these things. So you have the options are plenty where people can get help. So he's asking if we could come to the villages. I think we're there already. We're there already.
You're already in the villages.
So you and I are both ambassadors in that regard. Low sperm count, the next question, yes. Low sperm count has a genetic and non-genetic component. But if it's treated, we give treatments and it works, the man can father a child. It's as simple as that.
Okay, so there's treatment for
low sperm count. There's a treatment for low sperm count. The other is a commendation. Ovulation, and like we said at the beginning of this discussion, we've seen women that have come to the clinic and they don't know what ovulation is. You may try to explain, some would grasp it, some may not. And we've taught women how to know what ovulation is, the signs your body exhibits. And a few women have taken in with that. A number of women have taken in with that. So I think explaining what ovulation is to the populace,
whole topic.
Yes, is not within the purview of this discussion. Sorry for the terminologies. I tried to be as simple as possible, but somehow I was not able to be completely layman-ish in that. Apologize for the use of the terminologies. Herbal treatment in treatment of infertility. I'm a scientist, so I wouldn't talk. I wouldn't step out of my domain. I won't talk within. I won't delve into the spheres of what I don't have. I shouldn't talk about. Most of what I can confidently say is that most of the treatments that we give in the hospital, some of them are chemical compounds. Some of them, the drugs, some of them are chemical compounds, and a good number of them are sourced from plants, herbs now. So yes, there is the herbal component part of it, but again, I don't think it falls within the purview of this discussion to do. IVF, yes, IVF is available even in Jos. At the last count, Jos University Teaching Hospital and 4 other centers in Jos, private medical facilities, offer IVF. We're all religious and godly, but I'm not a pastor, I'm a scientist. So I won't talk about the sin, in quotes now, component of it. I would leave that for the clerics to do. He also made the person that made this call justifying infertility or giving infertility as a source of wealth. Again, I don't think I'm competent.
I think that's the stigma we talked about.
To talk about that.
Yeah.
We hear these things from the streets, from the marketplaces. He or she gave his fertility for a source of wealth. I believe it's not part of our discussion this morning. So maybe outside the studio, we can have a chit chat on that. I think we've been able to look at all of the questions, except I missed any.
Yeah. So maybe a last comment before we go to the listener now.
Okay.
The advice for anyone who is going through this and he's been wondering how to go about it.
So the parting word is simple. Infertility can be treated. Either male or female or both can be treated. You don't have to travel out of Nigeria. You don't have to travel to Abuja or Lagos. It's available, efficacious, and it works in Jos, Plateau State, Nigeria. That's one. 2, the ability of a man or woman to become a parent is a gift from God. So because we're all moral, we're all godly, the spiritual components should not be overlooked. If any of those, if there is an infertile couple or an infertile man or woman listening to this, I would advise that you join the spiritual component with the medical component, and then see how far the Lord will help you in that regard.
Okay, so maybe let me just see how to also round up this conversation. It's for you to remember that infertility affects both men and women.
Yeah.
So do not discriminate.
Yeah.
It's not a gender thing.
Yeah, it's not a gender thing.
Yeah. Then if you and your partner have been trying for a child for 12 months, am I right, doctor?
You're right.
Yeah. With no result, and the result is what? A child. Please speak to a doctor. Do not be ashamed. Do not self-medicate. Visit the family medicine. I have one here with me. So if you can get across to him, he's a family physician, and that's the first point of contact before you are now directed to a urologist or
endocrinologist.
Exactly.
Or pathologist.
Exactly. With that, you will get proper treatment. And the good news is that there is treatment for that.
Yes.
Thank you so much to all the hands in the studio I've had with me. Let me start with the studio hands first. I had Dorcas Ite as the DCA. Friday Jonathan is the studio manager. The engineer is Alex Aziz. I've also had Nerot Wang from the newsroom. And not forgetting all our, the IT students with us from PLASU. Thank you so much for your input to the program this morning. And I'm not forgetting Simon Selbo. Before he will take me off the stream, thank you, Selbo, for, streaming us live this morning. And the executive producer of this program is Rita Kachalon Pam. Supervising producer Hudun Gang, producers actually, Hudun Gang and Esther Nasera. The producer of the program, Inga Samuel, co-produced by Titus Datus. Okay, we'll see you again tomorrow on Good Morning Plateau for another interesting edition. Thank you, Doctor, for availing yourself for this discussion.